If our video on BPPV didn't quite match your experience with vertigo, don't worry. There are actually several other potential causes for those disease spells you've been having. And that's exactly what we are going to be talking about today. Oh, and if you haven't seen that BPPV video yet, check out the link on your screen now. Welcome to our video on what are the types of vertigo and how are they treated. We'll break down the two main categories of vertigo. We'll also discuss the common subtypes within each category. And we'll also provide you with some valuable information on how each type of vertigo is diagnosed and treated. So, if you're ready to learn more about the different types of vertigo and how they're treated, keep watching. Before we start our discussion, please do us a huge favor. Like this video and consider subscribing to our channel and hit the bell icon so you get notified whenever we post something new. Your Wellness Journal is run by nurses and we aim to provide informative health videos from the perspective of medical professionals who have been trained to care for you. Let's get on with it and talk about what are the types of vertigo and how are they treated. Vertigo is a condition that makes you feel like you or your surroundings are spinning even when there is no actual movement. It's a specific type of dizziness that can be quite disorienting and distressing. Common symptoms of vertigo include a spinning sensation, loss of balance, nausea, and sometimes even vomiting. It's important to understand that vertigo itself is not a disease, but rather a symptom of an underlying condition. And there are many potential causes of vertigo, which is why it's crucial to see a healthcare provider for an accurate diagnosis. Let's start with finding out the two main types of vertigo. There are two main categories of vertigo, which are peripheral and central. Peripheral vertigo is the most common type and is caused by problems within the inner ear. The inner ear plays a vital role in maintaining balance, so any disturbances there can lead to vertigo. On the other hand, central vertigo is less common and is caused by issues in the brain such as a stroke, tumor, or multiple sclerosis. The good news is that most cases of vertigo can be effectively managed with proper treatment. For BPPV, a series of simple head movements called the Epley maneuver can help reposition the crystals and alleviate symptoms. Other treatments may include medications, vestibular rehabilitation therapy, or addressing the underlying cause. Now, let's get into specifics and talk about peripheral vertigo. Peripheral vertigo is the most common type of vertigo. In fact, around 80% of vertigo cases are peripheral. This type of vertigo is caused by problems in your inner ear or your vestibular nerve, which are essential for maintaining your balance. There are a few different subtypes of peripheral vertigo that you might experience. The most common one is called benign paroxysmal positional vertigo or BPPV. This happens when tiny crystals in your inner ear get dislodged and move into the fluid-filled canals, causing a spinning sensation when you change your head position. Other subtypes include vestibular neuritis, which is caused by an inflammation in the vestibular nerve, often due to a viral infection. Then there is labyrinthitis, which is similar and also involves inflammation of the inner ear itself. And the other type is Meniere's disease. Meniere's disease is another subtype characterized by fluid buildup and changing pressure in the inner ear, leading to episodes of vertigo along with hearing loss, ringing in the ears, and a feeling of fullness in the affected ear. Peripheral vertigo can also be caused by certain medications that damage the inner ear, head injuries, and a tear or defect in the membrane separating the middle ear from the inner ear called a perilymph fistula. It can also be caused by a rare condition called superior canal dehiscence syndrome, where there's a thinning or a hole in the bone overlying the inner ear canal. Episodes last from a few seconds to a few minutes, though they can occasionally last for hours. The good news is that in most cases, peripheral vertigo can be effectively treated with medication, physical therapy, or specific head and body maneuvers that help reposition the crystals in BPPV. Now, let's move on to talking about central vertigo. Although central vertigo is a less common subtype, it can be more more serious. Central vertigo accounts for just around 20% of vertigo cases and is caused by problems in your brain, usually in the brainstem or the cerebellum, which are important for balance and coordination. There are several conditions that can lead to central vertigo. One of the most concerning causes is a stroke, where the blood flow to part of the brain is disrupted. It can also be brought on by brain tumors, multiple sclerosis, and vestibular migraines. In some cases, head injuries or infections affecting the brain may also be responsible. Studies have found that vestibular migraines are actually the most common cause of central vertigo, accounting for about 14% of total cases. Strokes were the second most common cause, responsible for about 7% of central vertigo cases. So, what exactly is the difference between the two? Let's talk about peripheral vertigo versus central vertigo. The symptoms of central vertigo can be a bit different from peripheral vertigo. While the episodes may be less severe, they often last longer. Sometimes the feeling of dizziness or imbalance is constant. Another key difference is that central vertigo is frequently accompanied by other neurological symptoms such as slurred speech, double vision, numbness, or weakness in the face or limbs. A 2019 study highlighted the importance of paying attention to these additional symptoms. They found that among patients with central vertigo due to stroke, 74% had at least one other neurological symptom in addition to the vertigo. If you are experiencing vertigo along with any of the other symptoms, it's crucial to seek medical attention promptly. Your healthcare provider will likely recommend imaging tests like an MRI or a CT scan to look for any abnormalities in your brain. Treatment will depend on the underlying cause. For example, if a stroke is responsible, emergency treatment to restore blood flow and rehabilitation will be necessary. For conditions like multiple sclerosis or vestibular migraines, medications and lifestyle changes may help manage your symptoms. Remember, while central vertigo is less common than peripheral vertigo, it's important not to ignore it, especially if you have the other neurological symptoms we discussed. Don't hesitate to talk to your healthcare provider if you are concerned. With prompt diagnosis and appropriate treatment, many causes of central vertigo can be effectively managed. Now, let's talk about treatment. For peripheral vertigo, which is the most common, treatment often involves addressing the underlying cause. For example, if you have BPPV, a simple procedure called the Epley maneuver can help. If what you have is BPPV, we talk about it and its many different treatments in our video on how to get rid of vertigo. We suggest you check that out if you haven't done so yet. If your peripheral vertigo is caused by vestibular neuritis or labyrinthitis, which are often due to viral infections, your doctor may prescribe medications to help manage the symptoms. These can include anti-nausea drugs and steroids to reduce inflammation. Vestibular rehabilitation therapy, a type of physical therapy, can also be helpful in these cases. For Meniere's disease, another cause of peripheral vertigo, treatment may involve a low-salt diet, diuretics to reduce fluid buildup, and sometimes injections of steroids or antibiotics into the ear. Now, let's talk about treatment for central vertigo. This type is caused by problems in the brain, such as a stroke, tumor, or multiple sclerosis. In these cases, treatment focuses on addressing the underlying condition. For example, if a stroke is causing your vertigo, you may receive clot-busting drugs or undergo a procedure to remove the clot. Vestibular rehabilitation therapy can also be beneficial for central vertigo. It helps your brain learn to compensate for the vertigo and can improve your balance and reduce the risk of falling. In some cases, your doctor may prescribe medications to help manage your symptoms. These include drugs to reduce nausea and dizziness, such as antihistamines, anticholinergics, and benzodiazepines. However, these medications can cause side effects like drowsiness, so they're not always the best long-term solution. The most important thing is to work closely with your healthcare provider team to identify the cause of your vertigo and develop a treatment plan plan that works for you. Don't hesitate to ask questions and express any concerns you may have. Together, you and your healthcare team can find the best way to manage your symptoms and improve your quality of life. If you are interested in deep dives into the possible causes of vertigo, such as Meniere's disease or vestibular neuritis, we have videos on that lined up for publication. We also have an upcoming video on the early symptoms of strokes. So, be sure to subscribe to our channel and hit the bell icon so you get notified when we have a new video up. We would love to hear from you. If you know of any other possible causes of vertigo we did not discuss, let us know in the comment section below. If you also have other tips on how to deal with vertigo, please comment it as well. We value your input, and any tips and suggestions will help the wellness community grow. If you haven't watched it yet, check out our video on how to get rid of vertigo, linked on your screens now. We are your wellness journal. Have a healthy day.